Assalamualaikum viewers and welcome back to my channel Biodenverse Hub. Today in the playlist of oral pathology, we will be discussing the oral ulceration and vesiculobullous diseases. In that series, our topic for today's discussion will be about Pemphigus vulgaris. Pemphigus vulgaris is a vesiculo-erosive condition that is characterized by the formation of vesicle erosions on the skin or the mucous membrane, and that mucous membrane could also involve the oral mucosa. So, in this video, our main focus will be on the oral pathological lesion that will be manifested as a result of Pemphigus vulgaris. So, first of all, let us have a brief intro about the Pemphigus vulgaris. It is a group of autoimmune diseases usually present in the middle aged. Females are more affected than males. Another important feature is that it has a racial origin. It is present in Ashkenazi Jews and more prevalent in them. So now we will study some types that are as follow. We have the Pemphigus vulgaris, Pemphigus vegetans, Pemphigus foliaceus, Pemphigus erythematosus, and Brazilius pemphigus. So these were the types of Pemphigus. Now we will be studying the Etiopathogenesis. So basically, an autoimmune mechanism is the one that play important role in development of pemphigus. Patient usually develop the autoantibody IgG and complement in his or her body. They are specifically targeted against the intracellular cementing substances that are known as the desmosomes. Desmosomes they were the junctions between the cell, usually important for their attachment and connection. The autoantibodies they are deposited in the skin and the mucous membrane against the desmoglin 3 and 1. That was the protein that is most importantly involved in the desmosomal attachment. Now they initiate an autoimmune reaction which eventually causes the destruction and dissolution of the desmosomal attachments, and the attachments they are lost. This leads to the acantholysis. Further accumulation of the fluid in the region lead to the development of intraepithelial bullae because there will be accumulation of fluid in that region where acantholysis have occurred. And we can also see a suprabasilar split in the epithelium as well. So this was the etiopathogenesis. Now we will be studying the histopathological feature. On histopathological examination, we will be seeing the formation of vesicle or bulla within the epithelium that often results in the suprabasilar split, means the cleft-like spaces will be seen as a result of acantholysis. The basal cell layer remains attached to the lamina propria and it appears as the row of tombstones, and other important and a peculiar histopathological feature of the Pemphigus vulgaris. There will be loss of intracellular bridges and collection of edema fluid that will result in the acantholysis within the spinous cell layer, and that will cause the disruption of the prickles. As a result of acantholysis, clumps of the large hypochromatic cell they desquamate that are often seen lying free in the vesicular fluid, and these are often rounded and smooth in appearance, known as the Tesang cells. Tesang cells is another important histopathological feature that is commonly seen in the Pemphigus vulgaris. Small number of polymorphonuclear neutrophil and lymphocyte may be found within the vesicular fluid, but there is relatively less inflammatory infiltrate in the underlying connective tissue, unlike the other vesiculo-erosive regions in which there is the inflammatory infiltrate in the underlying connective tissue as well. So this was the histopathological features. Now we will be studying some clinical features of the Pemphigus vulgaris. It occurs between the ages of 40 to 70 years, more prevalent in the female. Oral lesions begin as bulb-like blisters, diffuse gelatinous plaques. Soon, the rapidly developing vesicles or bullae on the several areas of the skin and the mucous membrane are seen. Often these vesicles they contain the clear fluid initially, but later on there is formation of pus as well. These vesicle and bulla they are very fragile and they radially rupture. Ruptured vesicle in the oral cavity they often leave extremely painful superficial erythematous ulcers with the ragged borders. These ulcers often bleed profusely and they may be covered with a blood-tinged exudate. Now we have another important sign present in the Pemphigus vulgaris, that is basically the gentle traction or oblique pressure that will cause the denudation, means the bulla formation or stripping of the normal skin or mucous membrane, and that is known as the Nikolsky sign, which is a very important sign to be noted in the Pemphigus vulgaris. Sometimes the disease may involve the entire body. In such cases, the patient condition becomes very serious. Patient may die of the dehydration and septicemia. Oral lesion in the Pemphigus vulgaris may involve any part of oral cavity, but most frequently affected parts are the soft palate, the buccal mucosa, the lips, and the gingiva. There may be the desquamative gingivitis that may be present in the patient. So this was all about the clinical features. Now we will move on towards the diagnosis. So for example, a patient came and that has the clinical feature we have mentioned previously. So how are you going to diagnose the case? So for that, first of all, you need to do the immunohistochemistry. That is, immunofluorescence test of the perilesion tissue often demonstrate the deposition of the IgG immunoglobulins within the intracellular areas of epithelium. Intensity of the fluorescence, it is great test in the suprabasilar, that is spinous cell region, and it is decreased in the surface of the epithelium, that is, it is decreased towards the surface as we move towards the surface of the epithelium. Secondly, the biopsy of the perilateral mucosa to detect the direct binding of autoantibodies to the intracellular area of epithelium. It is an essential diagnostic test. And third, they are the clinical features that were mentioned previously. On the basis of these three, immunohistochemistry, biopsy, and clinical feature, you will be able to diagnose the case of Pemphigus vulgaris. Now, usually, whenever the diagnosis is asked, here is usually a differential diagnosis as well that is being asked in the question. You can have the clinical scenario given in which you will be having the patient with the clinical feature that were mentioned previously, and then you will be asked about the differential diagnosis. So in that case, you can write the following differential diagnosis. You can have the pemphigus, erythema multiforme, bullous lichen planus, dermatitis herpetiformis, the desquamative gingivitis, toxic epidermal necrolysis, aphthous ulcer, epidermolysis bullosa. So these were some important differential diagnoses of the Pemphigus vulgaris as well. Now we will be studying the treatment options. So you can give the high dose of steroids, immunosuppressive drugs as it was an autoimmune condition. So you can give the azathioprine or methotrexate. Antibiotics to prevent the secondary infections, and again the fluid and electrolyte balance must be strictly maintained by the supportive hydration therapy in case of extreme dehydration. So this was a brief treatment options about the Pemphigus vulgaris. This video was a brief description of the Pemphigus vulgaris. I hope this video will be helpful for you all. Don't forget to subscribe to my channel for more videos and updates. Thank you.